grab your heaviest Theraband and your ball. We're going to come once again to lie supine, putting the ball under the tailbone and wrapping the Theraband around the arch of one of our feet. Guide the tailbone down so that we really get lumbar extension. Dorsiflex the foot. We're working on the plantar flexion of the ankles, combating it. At the same time, we're getting a great calf and hamstring opener. Keep one arm down for stability purposes. Do your best to connect with your breath here. Each exhale is a chance to go deeper into the stretch, to bring the leg a little closer to you without bending the knee. You can have a micro bend if you have bow-legged hyperextension in those legs, if you have a bit of bow-leggedness. Otherwise, I'd encourage you to keep the legs straight and the foot dorsiflexed. Check in with your breath. Inhale through the nose, as if you're putting on a tight pair of pants. Suck the abdominal wall in, hold it in, lift up on the muscles that stop your stream of pee. Fog a mirror with your exhale. Inhale through the nose, pull the navel in, lift up on the muscles that stop your stream of pee. Pull the leg closer, fog a mirror. Go ahead and switch sides, setting up on the other side. Footwork is essential before doing standing work because we want to use all sides of the feet evenly. This will help balance the flexibility, and it will help with the recruitment of the right muscles for strength training. So again, using the exhale to go deeper into the stretch. Watch out for the rib cage spraying out. Back ribs press heavy into the floor, tailbone reaches away. Inhale through your nose, pull the abs in, brace them as if you're putting on a tight pair of pants and holding them in. Brace, brace, brace. Exhale. Don't let that belly push out when you're exhaling. Inhale through your nose, pull the abs in towards the spine. Lift up on those muscles that stop your stream of pee, and exhale the air out the mouth, holding that lift. Pulling the leg closer on that exhale. Let's come out of that stretch, making our way up to stand. We're going to bring our roller by the wall and grab a 3-pound weight and our ball. The ball goes between the inner thighs. I'd like you to start working your non-dominant arm. So your non-dominant arm should be to the outside of the wall, the farthest away from the wall. Make your way up under the roller, soft bend in the knees. You should be holding onto a wall or a countertop for safety purposes. From here, once you have your balance, I'd like you to hinge forward from your hips. Arm is relaxed down, and we'll begin some back flies from this hinged position. Lifting up, 2, 3, and lowering down, 2, 3. Taking it up, 2, 3, and lowering, 2, 3. So a good thing to think about here is the tailbone reaching away from you, so you have some lumbar extension, the belly button staying pulled in and up towards the spine. Soft micro bend in the elbow of the arm that's going out to the side, keeping the shoulder plugged down the back. Lifting up, 2, 3. Inhale, lower, 2, 3. One more time. And lower with control. And slowly step off the roller. We'll set up on the other side. Take your time here. Make sure when you step up onto that roller, your knees are bent. Make sure you have a wall. Safety first. Hinge forward from the top of the hips. Soft bend in the knees. We're not in a squat. And begin your arm work, taking it up, 2, 3, and down, 2, 3. Exhale to lift, bracing the abs, tailbone reaching away and back. Inhale, lower. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, 2, 3. 2 more. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, 2, 3. We're going to come off of the roller carefully. We will grab our heaviest loop. We'll grab our heaviest Theraband and our lightest loop band, bringing the loop band around the ankles and the heaviest Theraband behind the back. Pull out on that band. This will help you find the serratus anterior, your shoulder blade anchor. Set up profile to the wall. You're going to step to the side towards the wall in the frontal plane to balance in knee flexion. Pulling out on the band, hold it here. Inhale 1, dorsiflex the foot, exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3, and bring it back. Repeating again on this side. Stepping to balance, soft bend in the supporting knee. Equal weight between the bone of the big toe and baby toe. Sternum reaching back towards the back ribs, tailbone reaching back away from you. Abs pulling in and up. Pull out on that band. Palms should be facing forward. And let's make our way to the other side, setting up. When you're ready, step to balance, keeping a soft bend in the supporting knee. Inhale 1, breathe. Exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3, and repeating. Step to balance, soft bend in your supporting knee. Dorsiflex that lifted foot. You're in knee flexion. You're pulling out on the Theraband behind you with the palms forward. Your focus is eye level or slightly higher. Collarbones wide, shoulders plugged down the back. Rib cage is closed. You can think about that sternum reaching towards the back ribs. And from here, we're going to come against the wall. We'll take the bands and set them to the side for an eagle serratus anterior release. Eagling up the arms, crossing one elbow under the other. Tailbone is against the wall. Feet are slightly in front of the wall. You're just going to round forward. The upper body relaxes, and the elbows reach away from the chest and towards the chest. Away from the chest and towards the chest. And away and towards, round up, switch those arms, rounding back down, move the arms away and towards, and away and towards, one more time, away and towards, rounding up. Turn and face the wall, step your dominant leg back, look over your shoulder, make sure it's nice and parallel for a calf stretch for the gastrocnemius, very overactive muscle with flat back posture. Drive the hips forward. Keep your focus now up, eye level in front of you. Pull the abdominal wall in. Each exhale is a chance to go deeper, driving the heel down behind you. Keep driving the pelvis forward at the same time towards the wall. Keep the abdominals firm. And let's focus on your transverse abdominis here. Inhale through the nose. Pull the abdomen in. Lift up on the muscles that stop your stream of pee. Hold that lift as you exhale the air out. Drive that heel down into the floor. Inhale through the nose. Abs in. Brace the abs. Pelvis presses forward. Heel drives down as you lift up on those pelvic floor muscles that stop your stream of pee, and you're fogging a mirror with your exhale. Go ahead and step forward. Legs should start hip distance apart. Step the opposite leg back. Look over your shoulder. Make it perfectly parallel, that foot. And then square the hips to the wall, driving them forward towards the wall. Hands should be about chest height. Focus up, eye level. Shoulders down the back. Inhale through the nose. Pull the navel in. Brace the abs. Exhale, drive the heel down and the pelvis forward. Inhale through the nose. Abs in. Brace. Drive the heel and pelvis forward, heel down. And one more time, inhale through the nose. Like you're putting on a tight pair of jeans, suck the abdominal wall in, hold it in. Lift up on those muscles that stop your stream of pee. Sustain that lift as you fog a mirror with your breath. Stepping forward. Great job.